keynote speech by Honorable Jason Wood. We will have video presentations. We will have a very brief talk by Dr. Sukanya Mulidharan, who is from Wheelers Hill Clinic, and I will introduce her when she's making the presentation or delivering a small talk, and then we will have a discussion session where we will be discussing various aspects of vaccination, and we will be talking about your comments. If there are any questions that any of us can answer straight away, we will try to answer them. Otherwise, we will collect the questions and come back to you with answers as soon as we can. I will now move on to our honorable guest speaker for tonight, Honorable Jason Wood, who is the Assistant Minister for Customs, Community Safety and Multicultural Affairs. And before I pass the floor to Jason, I would like to welcome Jason once again and thank him for making time for this very important event tonight. Jason is a massive supporter of multicultural affairs, multiculturalism. He has supported many projects at the Officer Sikh Gurudwara, Shri Guru Nanak Darbar, and he has also, demonstrated his commitment to multiculturalism by supporting a lot of multicultural projects in different communities with different communities. Jason has also played a very important role in the process of setting up a multicultural hub in Cardinia Shire region, which will be having a prayer room, a big hall for events, and different areas where people can do interesting things, kids can play as well. Thanks a lot for that wonderful initiative, Jason. And being a supporter of multiculturalism, Jason essentially wants all of us to get vaccinated so that we can set trends with higher vaccination rates, not only in Latrobe, but all over Victoria and Australia. So without a further ado, I will pass on the floor to Jason. Welcome, Jason.
Thank you so much, Harpreet and Sastral Kal, and also Namas Day. And can I say, first of all, acknowledge our traditional owners of our land, our elders, past and present. Also, can I give a very special thank you to Dr. Sukanya, I'm going to pronounce this wrong, but Mulidharan, who's the principal doctor at Wheelers Hill Medical Clinic. Thanks so much, Doctor, for giving up your time tonight. I try to keep away from the medical questions, but having a GP here tonight in this forum is so important because you're the one out there is right up to date with what's actually happening in the COVID world and the vaccinations. Also, I know we've got my friends Karthik Arusso on here and Sunny Dugal. And I just heard you mention, was it Sunny Singh, the police youth ambassador, I believe. So great to be with you all here tonight. And first of all, can I say our thoughts and prayers are with the Afghan community. And can I say my office in particular, Rands, we've been on the phone and sending emails, trying to get visas approved, not only for local Afghans in Australian Afghan people in our community, but those who've identified others, especially women and children, in great danger overseas. And it's been a really, really busy time. I've actually just got off another Zoom event for the Muslim community. This is a very special conversation, and Harper, well done for bringing it on. And can I say, and I'm obviously with the Liberal federal government with Prime Minister Morrison, the only way we're going to get out of this COVID-19 is vaccination. There's no anyone thinking it's not going to come to me, don't worry about it. And I'm sure we'll from the doctor. The only way to get out of this is vaccination. To be honest, I think in Australia, in Melbourne, we probably, including myself, like I didn't charge off straight away when they could have got the AstraZeneca vaccination. Once it went into lockdown, the next time I did. And we're seeing what's happening in New South Wales too, with over 1,000 cases today. But in saying that, there's huge light in front of us of getting out of this. And I'll just read some figures out. So sometimes we forget what figures there are out there. Now, 86% of people over the age of 70, they're the most vulnerable in our community. I know how close our Indian community is with the parents, with so many parents and grandparents staying at home with their children, but 86% of people over the age of 70 have had their first vaccination, and 60% have had their second vaccination. Remember, the PM's target is to get between 70-80% of second vaccination doses. And more than 76% of people over the age of 50 are protected with their first dose. That's 76%, so that's above our target. And 48% have received their second dose. Now, when it comes to the wider Australian population over the age of 16 years, 56% now have had their first dose, and 33% have had their second dose. So now 1/3 of Australia, we can say, is fully vaccinated. And for you giving up your time tonight, can I congratulate you? And I know how interested and concerned you are about COVID-19. I just want to relay, we just had a doctor before who's an infectious diseases doctor in the New South Wales hospital, was on the Zoom event, and I actually asked her a question. And the question was, we're hearing kind of concerns about children and getting COVID-19. I said, what do you experience? And then she said, the rates in actual fact of children getting any sort of major impact or going to hospital is exceptionally low. However, in saying that, when my follow-up question was, with a young person then, if they're getting very mild effects, if they then potentially pass it on to an adult, to a grandparent, does that mean it's also mild? And she said, no, it's the same disease. So that is a very important message, especially for our older community who potentially haven't had the vaccination, who want to play with their grandchildren who may be non-sympathetic, who may not have any symptoms at all. We just need to be very wary of that. And the other one was, what does a vaccination do? And we hear this more from the doctors. Basically, it's like I put in the most easiest, bluntest terms, as Professor Doherty from the Doherty Institute said, what would you rather have going in your body? A virus which has had no medical protections, or your body's can't do much, it attacks your immune system or whatever, or compared to something which has been developed to stop it. Like, okay, you're getting things going in your body, but surely the virus has to be much worse. So with us locally too, and it's so important to listen to the government messages. I know it's and I'm hearing this in my office all the time when it comes to mental illness, for business people who just want to open and they can't open the cafe, and then you have retail, hairdressers. Like, I know even my wife's pointed out to me, hairdressers and these simple things, trying to get a haircut, you can't do. But then think about the business person, how tough it is for them. We've had obviously the job keeper and the job seeker at the federal level, but the only way I keep saying to get out of this is the vaccination. Now, just one thing too, I won't talk for too long because I know it's a Saturday night. Harper did actually mention the Multicultural Hub locally. Just working with council, I secured $360,000 for planning and design of that. It's coming to the phase now where we're looking at potentially, which I will do, is try to secure federal funding for that. It'll be in Pakenham, probably around the area of the Living Learning Centre. It's no lay down misere. We need to get something like $26 million. And one thing I'm really focused on is having a place for younger people, for seniors to go. Also have a commercial kitchen where you can come and have a big event. Now, I see the great photo of the Officer Gurudwara with what you've done there, Harper. And I think we secured over $500,000, and the great tireless work you've done there, and also with the toy library. But when you need a big event, a big function, and remember, offices, probably one of the fastest growing suburbs in the country. We're seeing a lot of Indian come in, Sikhs obviously moving in there. We want something, a big event, and that's looking at to the future. And when you look at upgrading roads in the area too, what we've tried to do during COVID-19 is make sure work is continuing on. For example, when it comes to the Beaconsfield interchange, you see the workers out there, and it's so important to make sure we keep the people on the ground working as best we can. So, Harpreet, I'll leave it there. But the other thing is, too, our thoughts and prayers are actually with our friends and your family members back in India. Sadly, it's nearly $500,000 of 500,000 people have passed away from COVID, which is an awful number. But amazingly, and this is what is so incredible about India, 500 million vaccinations have now been administered. Incredible. And also, just on our behalf, the Prime Minister obviously has a very good relationship and again, showed great compassion, making sure Australia assisted. We provided 3 tons of medical equipment. In the proportion of India, it's very small, but we just want to make sure Indian friends and your family understand we're right there with them. Thank you very much, Harpreet.
Thank you, Jason. We really love, hearing you and all the work that you are doing. And most of us already, get a lot of updates from you through your Facebook page, which is updated, or, you get 3 or 4 posts every day coming from Jason talking about the vital things happening in the community all across Australia. Thank you once again, Jason. I would also like to acknowledge that we have with us Karan Gandhok, who is the Vice President of Australia India Society of Victoria with us. I also would like to acknowledge that we have Nayana Bhandari, who has also joined us, and she was covered by AGE for her ongoing work on how to encourage vaccination in the Indian community. Welcome to both of you as well. We will now move to a small video presentation about vaccination, which is coming from the Australian government. It basically explains all of us, what vaccination does, how it works. Avtar, are we able to run the previous slide with the video? Thank you. Avtar, the previous.
Please.
Yeah, this one, Avtar. Thank you. Sorry for the technological hang-up. Avtar, do you want to play directly? Apologies, guys, some technological snag.
Safe, effective COVID-19 vaccines will offer protection against the virus, helping to prevent death and serious illness. But how do they actually work? Like other vaccines, such as the flu shot, COVID-19 vaccines will be given with a needle. This triggers an immune response in the body, which is the body's natural way of defending itself. The vaccine will strengthen your immune system by training it to recognise and fight against the virus that causes COVID-19. Vaccines may contain either killed or weakened versions of the virus that causes the disease, or a small part of the virus, such as a protein. There is no risk that you'll get the disease from a vaccine. When your immune system recognises this virus or parts of it in the vaccine as being foreign, it responds by creating memory cells and antibodies that will protect you against or disease. As a result, you'll be less likely to have severe COVID-19 symptoms after a vaccination. To learn more, visit health.gov.au.
Thank you, Avtar. I think this is a very interesting video from the Australian government, which explains to us how vaccines work. We will now run another video, which is actually a video done by our kids, our young kids, and they are actually making a plea to all the community to get vaccinated. When we came up with the idea of this video, a lot of organizations encouraged us, and you will see the logos of all of these organizations towards the end of the presentation video. But most importantly, please
trust science and medical research.
Doctors are confirming that COVID vaccinations have very, very less side effects.
Sometimes we think that we have a low infection rate in Australia, so we don't need to get vaccinated, but we need to get vaccinated for everyone's safety.
The vaccination will protect all of us in the family. Dear parents and grandparents, if you're vaccinated, your kids are also safer.
We wish to visit our grandparents and relatives overseas in India.
This will only happen if we're vaccinated.
So get vaccinated.
We want to go and watch footy and cricket in stadiums, and we want to travel to new places, and only vaccination will make that possible.
Dignitaries and our role models have been vaccinated, so why should you not?
I had so many vaccinations since birth, so why are you worried?
Vaccinations will help Australia open its borders, stop lockdowns and help our economy improve.
Don't trust myths, only trust reliable sources of information, example World Health Organization and our governments.
Please find time. Do not take the situation lightly and book an appointment to get vaccinated now.
This vaccination in Australia is free of cost for all, irrespective of their visa status.
thank you, our wonderful kids. Very, very interesting messages coming right from their heart. But as most of us say, child is the father of man. So I think if you do not believe us, if you do not believe science, start believing our young children who are giving very important messages, and please get vaccinated. We will now move on to the next part of today's evening, which is a brief talk by Dr. Sukanya Mulidharan. Dr. Sukanya Mulidharan has experience in all areas of general practice, psychological medicine, and mental health. And Dr. Sukanya is the principal and partner of the Wheelers Hill Clinic. And I would like to thank Dr. Sukanya for making time at such short notice. This event was actually, decided on, I think, Thursday late evening. And within about less than 48 hours, we have been able to, pull this event on. So thank you, Dr. Sukanya. Over to you. Can we please unmute Dr. Sukanya? Thank you.
Hi, good evening, everyone. The Honorable Mr. Jason Wood and the President Harpreet, Kendra, and Mr. Ranjit Pereira. Thank you for giving me this opportunity to talk about the preventive health. I'm Dr. Sukanya Mulidharan, Murali's wife and proud mom of 3 boys. In Australia, I started my career working at Monash Emergency, which I really enjoyed and had a lot of thrilling experience working for 6 years. Then went into GP program at Southeast Gippsland for a few years, and for the last 15 years have settled down in Wheelers Hill, working towards preventive health. My main interest is aged care and mental health, which has been really challenging experience during this pandemic time. Now, COVID-19 virus and vaccine. I'm not going to give you any information that you all already don't know, and I'm not going to talk about the pathophysiology and biochemistry to make everyone feel sleepy. I'm here to emphasize the importance of the vaccine. Now, over time, all Australians will be exposed to the virus. It's an infectious disease. By wearing personal protective equipments, hand wash, and social isolation, we only can reduce the transmission. The vaccination is the only best way to develop the immunity and prevent the disease. Now, number of cases and community transmission is going to change all the time. Do not wait for that. And we are already at medium to high exposed risk. Now, before we talk about the COVID vaccine, I will talk about some of the few viruses that we already know. The common one is measles vaccine. I'm sure we are all vaccinated for measles, and our parents have been vaccinated, and we have vaccinated our own kids, which give us a high herd immunity level. Still, at our GP clinic, we still diagnose about 3 to 4 measles cases per year. But as a mom and a doctor, certainly I know that all those kids are safe because they are not going to get the complication of pneumonia or encephalitis, which is the infection of the brain covering. Now, the other common virus that everyone knows is the polio. Most of us had the few oral drops, which really protect us from getting the leg paralysis. The WHO is working on the polio to eradicate it from the world only by giving the vaccination. Smallpox, which is totally eradicated from the world by the vaccination. Now, influenza. At aged care, almost 100% of the residents have been vaccinated. Still, couple of them needed the hospital admission due to the flu-like complications related to the flu virus. Why did this happen? Because of the transmission. Some of the residents' relatives and some other healthcare workers and chefs and the cleaners and admin staffs and the resident relatives, some of them who did not have the vaccine, transmitted the virus. So DHS stepped in a few years ago, and anyone who is going into the aged care facility need to show them the flu vaccine certificate. Since then, all our aged care residents are protected. Now we'll talk about the COVID vaccine. What is that going to do? It's going to prevent the severe disease. It's going to prevent us getting any organ failure. It's only going to prevent us from getting prolonged hospital admission, which can lead to lifelong disability. And it can prevent the ICU and the HDU admission, which will in turn reduce the mortality rate. My role as a GP who work on primary prevention. At my clinic, I'm very proud to say we have given 5,500 COVID vaccine to date. This afternoon, I ran the COVID clinic at my clinic, and I was able to vaccinate 84 patients. We are not only doing our clinic patients, we are doing all the patients close to the Wheelers Hill area as well. Now, we have been covering all the aged care after the post mass immunization program which was done by the government, Sonic Health. There are a couple of residents needed the vaccine, and the residents who have been coming with the respite care and also the non-Commonwealth funded aged care facility, the SRS, we have been vaccinating all of them. And also the independent living residents who live surrounding the nursing home. Now, when it comes to the COVID vaccine, whether it's AstraZeneca or Pfizer or Moderna, all are equally effective. Now, how does the vaccine work? It's an antigen that goes into your body, then your body reacts to develop the antibodies, which is the way it reacts to develop the antibody in your body. You get all the non-specific symptoms like headache, nausea, vomiting, diarrhea, muscular pain, body ache, and tiredness. The treatment for the side effect, the immediate side effect, I'm sure all of you all know, rest, fluid, Panadol, and tender loving care. Now, when it comes to the flu vaccine, how many of you all know what is the flu vaccine that you all had last year or the year before? There are Fluvax, Fluvarix, tetravalent, hivalent, Afluria. None of us know what type of flu vaccine we had because we trust the high standard of the Australian health system to know that we are getting the right flu vaccine. Take about the whooping cough vaccine. There are Boostrix, Adacel. We still don't ask the doctor what whooping cough vaccine we are getting. It's the same that comes to the COVID vaccine. Whether it's AstraZeneca, Pfizer, or Moderna, it's still equally effective. Now, there are some complications that can happen like all the other vaccines. The main concern with the Pfizer vaccine is the risk of the cardiac muscle and the covering inflammation. That is actually the same risk as the people who are not having the vaccine as well. Now, the risk with the AstraZeneca, obviously, everyone is worried about the risk with the clots. What's the chance? 2 in 100,000. How do they get the clot? It's the immune-mediated reaction, which reduces the platelet count and which causes the clot. The only risk factor so far that have been found for this immune-mediated related risk factor reaction is the age. That is the only risk factor that so far have been found. Because of this, the younger people are more at risk getting the clot due to the AstraZeneca vaccine. That's what the guideline says. Anyone under the age of 60 will get the Pfizer vaccine. I'm sure everyone knows Pfizer vaccine have 2 doses, 3 weeks apart, and in a week time you get the immunity, whereas AstraZeneca 2 doses, 10 to 12 weeks apart, and in 2 weeks time you get the full immunity. Now, the risk with this clot, with the same, it's much more lesser than getting the contraceptive pill or someone getting pregnant. Even long distance travel have much more higher risk of getting clot than getting the clot with the AstraZeneca vaccine. And also imagine if someone gets the clot due to the COVID infection, that is a disseminated clot, that is almost, we are talking about the end stage in that situation. Now, risk of getting the infection after the vaccine, we still can get a positive swab and we'll get some mild symptoms. But severe infection is less likely. Now, it's our generation responsibility to vaccinate the older and the younger generation. The vaccine is the only way that's going to prevent the COVID, to reduce the long-term complication, and to protect the unvaccinated people, which I'm talking about the herd immunity here. Now, if we achieved a good herd immunity, we are not going to talk about how many positive cases that we are going to have in a day. We will be only talking about hospital admission and death entirely due to the COVID. So we are not going to talk about the positive cases at that stage. Also, vaccine is going to reduce the transmission to open the borders, which will immensely help the mental health, especially for the kids and adolescents, even for us. And also, I'm sure everyone will know, vaccine will improve the personal, community, and the country's economy. So get the vaccine. Don't let the virus control you. Get vaccinated. Thank you for the opportunity to give me a bit talk about the preventive health.
Thank you, Dr. Sukanya. That was really amazing and very well covered. As Dr. Sukanya Mulidharan, you remind me of Muthaiya Mulidharan. So I would say that, the way Muthaiya was amazing with his bowling, you have been amazing with your brief talk, telling us most things that, we are worried about. I will now move on to the next part of our discussion. We have about 20 minutes. So we will quickly talk about some points. First of all, I would like everyone to think about, what got them motivated to be vaccinated in first place. I would like to take the opportunity to congratulate all of you on behalf of Jason and the Gurudwara Shri Guru Nanak Darbar, because you are leaders who got vaccinated already. So if you want to key in any answers in the chat window, why did you get motivated to get vaccinated? What motivated you? Please do that. And also, talk about what are you hearing generally, why others are not getting vaccinated. Feel free to, type it in the chat window, and we can certainly give an opportunity to a couple of people to, to talk about, these 2 points, which we are discussing today. What is the motivation for you to get motivated and to get vaccinated, and what are you hearing around, why is that people are not getting vaccinated, for those people who are hesitant. Randeep, are we able to take a couple of comments or observations?
Yes, so I've got 2 questions already, but they are general topics, not necessarily the motivation question. So while we let other people write in about motivation, maybe I can just ask these. The first question is from Mr. Mulidharan. He asks, are GPs getting Pfizer vaccination stopped for the general public?
Sukanya, you might be able to answer that.
So the question is, are GPs getting Pfizer vaccination stopped for the general public?
Yes, we do. As I told you all already, some of the clinics have been given the facility to give the Pfizer vaccine. We are one of them. My clinic is Wheeler's Hill Clinic, and you can go into the website, and if you are under 60, you can go online and book for the vaccine. Or you can go through the website and then find some other clinics who, yes, the GPs are doing the vaccine.
Thank you, Dr. Sukanya. Randeep, is there another question?
Yes, one more question related to the vaccine. How long does immunity last after the second dose of COVID vaccine? And also, is there any difference in the length or duration of immunity afforded by the Pfizer versus AstraZeneca COVID vaccine?
The answer that I can give that I know of, like, for example, my brother is in USA, he's in Michigan, he's an intensive care unit consultant. He had 2 Pfizer vaccine and it's almost 8 months. they are getting a booster. So it's a virus vaccine, so it's not going to be 100%. We do need to get a booster, but right now the target in Australia is to get everyone vaccinated. Then definitely we need a booster. At Pfizer, it's 8 months at this stage, and AstraZeneca, I'm not sure about that answer.
Thank you, Dr. Sukanya. We have a hand raised from Gurinder Kaur. Can we spotlight her probably? And
yes,
get her to
just a minute. Okay,
Gurinder
you
Kaur.
can unmute yourself, Gurinderji. Thank you.
Thank you, Sri Guru Nanak Darbar Gurudwara, first of all, for organizing this session. This is really great, I think. And as many of you have already raised comments in the chat as well, definitely the motivation is to meet your family and just to unite with everyone and be safe. And as Naina mentioned, there is a long list. I just want to talk about some hesitants only. For example, when we say that 80%, there was recently news that Victoria is aiming at 80%, and then we can actually plan about, getting back to normal. There has recently been a news that people are talking about that Israel already had 80% of vaccination, which was Pfizer vaccination as well. But there is already a COVID boom again back in Israel. So people are hesitant that even the countries which have already got 80%, still they are getting like 6,000 cases in a week. That's one of the concern coming up from the community they're talking about. And secondly, the community is definitely saying that, okay, with the country, probably the government is trying to, push people to get vaccination. That's why there are so many cases showing up. So there are different stories that coming up. Some people believe, okay, after a few years of the vaccination, the lifespan will actually decrease with this vaccination. So if anyone else has been hearing, I think we would like to just learn some comments.
The long-term complications with the vaccine, it's not going to be there, because when you give the vaccine, the particles are going to get destroyed to form the antibody. So there won't be any long-term complication with lifespan. And what happens, like, for example, with influenza, the things that happens here, now we don't talk about how many positive swabs that we are getting with influenza. We only talk about how many hospital admission and what's the death rate. That's what will happen when 80% get vaccinated. Now, what's happening in Israel is, I'm sure they are talking about the positive swabs, number of positive swabs. They are not talking about the number of admission that happens after the vaccine. That's the one that we have to concentrate.
Thank you, Dr. Sukanya. I think we will move on to the next question. There are a lot of very interesting messages coming around motivation and hesitation in the chat windows. So please, make a note of those things. You can view them, and we will also try to compile this talk and the chat messages and pass it on to all the participants for them to have a look. And we'll move to the next question or the next point of discussion. Avtar, can you please put the next point, which is around fake news. Now, all of us would agree that, there might be some rumors going on here and there. And one of the rumors that I have heard a lot is around the lifespan. After I get vaccinated, is it going to take away 10 years of my life or what? And others might be hearing those fake news as well. I would actually want, the participants to raise their hand and talk about any fake news that is, going around. And we can certainly, play our own part by directing these people or ignoring these messages. And directing people to the right source of information and medical practitioners and researchers who have done the research. So what are people hearing, about the rumors? And at this stage, I'm happy if Nayana wants to, unmute herself and talk about this, because Nayana has recently been covered by AGE for her work in the community. And Nayana can, tell all of us, what she has been hearing about on different WhatsApp messages, which are, fake and rumors. Thank you. Nayana, over to you.
Thank you so much, and namaste and sat shri akal to everyone. And thank you for letting me know about this opportunity, because I believe this is actually an opportunity nowadays to come together for a global issue and talk about it more openly. So in regards to, I would say, fake news, well, I have heard heaps of content. And the reason around that is definitely we get influenced by universal news. It's not about what only happens in Australia. We do hear and watch a lot of global, I would say, news. And out of that, one of the most weird thing I have heard is that there is coolant being added to the vaccine. And it might sound you really weird, and that was my reaction as well. But apart from that, it also affects the fertility for women, and it also impair your genetic disorder. They're trying to insert chip into you. I mean, I've got a whole list of it. And this is not only, I would say, I'm talking about a small group of 10 or 15 people. I'm talking about hundreds of people whom I've been in touch by this way or the other. My only concern, and I believe that I think this is a very right platform to raise that concern, is we are reflective of our communities. We are here because we represent a migrant background. And when we talk about a migrant background, the people who are present at the moment are a kind of leaders from the community. But when we have to talk about the real community, there is a whole grassroots people who are not in touch of these sessions largely and widely. And what happened, they kind of compile that information on the basis of when they meet their hubs, another group of people. So my concern from the beginning of COVID up till now is that we are not having enough translated materials. We are not having enough interpreted information, and we really need to find out whom we want to target, because I think this is my 15th or 17th around that COVID update group or session I'm attending. But then when I talk about a common man, they're still away from what exactly is happening at government level and what exactly is happening at medical level, how we can take that information down to them, how we can reflect what exactly is happening at planning level and implementation level is really vital. And if through this platform this can be taken up further, that will be really good. Thank you.
Thank you, Nayana. Very, very useful insights. And I will talk about a story that was on WhatsApp a few months ago, with a Nobel laureate doing a press conference and telling everyone that if you get a vaccine, you will die in a few years or a few weeks. And then, I think, someone contacted the Nobel laureate again and got a statement around that. Now, I would urge, Jason and his government and the departments probably to, have a link where, all of these rumors can be addressed. And, if these rumors can be addressed, Jason, we could possibly translate them in Hindi and Punjabi and other languages and start sharing them through our portals. That could be one of the takeaways for you and for us, I think, from this discussion. Jason, what do you think about that?
Well, can I say, in actual fact, there has, I hate to guess the number, but there has been material translated in many languages. And as I was on another event tonight with the Muslim community, and I think the doctor, what you're saying, and or both doctors, but can I say the most trusted source is your own doctor. So, and what I always find amazing when we're hearing people about conspiracy theories and all those sort of things, it's by some, I wouldn't say, well, maybe lunatic online is coming up with things. And also we know other countries have deliberately spread misinformation in Australia and also America and the UK, the countries which are obviously not being our friend. I'll take it away. We can always do better, and it does always concern me when you're saying, hang on, we're not hearing the message out there. And as you put up before, Harpreet, you put up the videos before. I've put those videos up on my own website, or sorry, Facebook, in Punjabi, in Hindi, you name it, you name the language. But we can always do better. And again, I think the doctors, because the work you're doing on the front line is just so important.
Thank you, Jason. And we will move to our next point of discussion about, being a role model. Now, all of you, on a Saturday evening are here to, understand vaccination. And, I think you will be taking these messages back to your communities. Can you think of what role you can play to encourage people to get vaccinated? What role you can play to, to demystify the information or the myths around not getting vaccinated? Please feel free to key in the chat window, and I can, ask Sunny to say something if he wants to say for a minute. Sunny? Sunny, can you hear me?
Hello, RPG. Thank you so much. Acknowledge Jason Wood, the Honorable Minister, and all the other dignitaries who have joined. And yeah, just on the access to translated materials, like Nayanaji was mentioning, there's plenty of material as we see is available, and I'm pretty sure we all are on daily briefings with the departments on various certain stages, and we daily get updates. But if there is something which is missing on state level, on federal level, as you heard the minister itself, there's always help there. And I just want to bring the topic on vaccination we're talking about. There's a community program which is going on. If you have been vaccinated yourself, how can be your voice for others to vaccine? So you have to set an example for yourself and your community. So there is a program called EOI, Expression of Interest, is going on for that community champion who have vaccinated themselves and get another 10 people to vaccine. I think we all can move this cause further and break the myths, and it's not hard. And that chain can substantiate. I myself have done an internal survey with my media team where we got 20,000 people fully jabbed within our community. So there is a task ahead, and we should all take care. And I think I acknowledge on that matter. So let's work on that one. Thank you, Harpreet.
Thank you, Sunny. Very interesting point, the EOI around, encouraging others with getting vaccinated. And I think one of the takeaways from this meeting could be that, all of us can, probably change our Facebook profile images saying that we are vaccinated. And that brings a lot of confidence in the community. Some people are still sitting on the fence, unsure whether they should get vaccinated or not. And maybe your Facebook picture or your WhatsApp profile picture can possibly encourage them to, jump over the fence and go to the GP or go to the centers and get vaccinated. Again, a last point which has been covered in the previous discussions around support. How can we encourage others to get vaccinated? And I think I would say that, again, we need to translate materials regularly and demystify the myths going around. In interest of time, we will move to the next slide, please. And the next slide is essentially, we are about to close this online discussion. I would just like to tell you that, if you have any ideas around, promoting how to vaccinate the community, feel free to send those ideas to our email address, which is on the screen. And again, we will certainly forward it to different authorities to bring this to their attention. I can't promise, what would happen, what would not happen, but we will certainly pass on the message. There would be a lot of questions still going on in your minds about vaccination and other things. Feel free to, email us. As I said, this is not a medical forum, but we can certainly pass on the message further. There are messages coming around troubles with vaccination, getting appointments. There are questions around, when would the kids also be vaccinated, those in the age group of 12 to 16 plus. But since we have very limited time today, I would encourage everyone to email us those messages, those questions on this email address that you can see on the screen, info@scnd.com.au. I would also like to take this opportunity to tell you that, the Gurudwara in Officer is providing grocery kits to the community to support them. And this morning, along with Gurinder, from Sikh community connections, we have prepared 100 grocery kits. And I think Gurinder has done another 100 at her end, and those are being directed to Shepperton, where about 1/3 of the community is under isolation. And I think there was a hand that was raised by one of the community members. Can we get them to talk? Randeep, did you want to talk?
Can we have Satinder, please?
Yeah, Satinder.
Please unmute yourself and then ask your question.
Hello, everyone. I'm hearing all of your voices. So everyone is doing good on their part. I have made some small videos, which I have, one of the link I have sent it in the chat. So if you guys are interested, you can just, make an awareness from that video. That is with 2 kits I have made. And I have made, say about 3 or 4 organizations video. Everyone is saying about mask, as well as vaccination, as well as how to come over this COVID-19. So I would like to request each and everyone, if you want, you can share it from my page, or I have sent the link in the chat. Everyone,
are we okay to put it on our Facebook page?
I don't mind.
Thank you.
Because this I have made it just to spread the message.
Thank you, Satinderji.
Thank you.
We have another question from Brijal, which will be the last question for the evening. Thank you.
You can unmute yourself, Brijal, and ask your question.
Thank you, Randeep, and thank you, Harpreet. Firstly, would like to extend my thanks to Sri Guru Nanak Darbar for hosting this evening. Very good information has been passed on to everyone. One of the things I would like to seek here, because we have got a lot of people from different communities and community leaders, we all can get together and make a video in different languages, which can be in our mother tongue and can be shared as one to all the Indian community and also the other communities. Just a thought that came from
Excellent
my end.
idea, Brijal. I'm happy to work with you on this and with other community leaders who are attending this session today. Thank you. I'm towards the end of this discussion. I would just like to tell you that if anyone needs any help with groceries, Gurudwara, Sri Guru Nanak Darbar is keen to provide that. We are also providing latest information on COVID. We can also provide help with vaccination appointments and also, arrange a transport for anyone to go to the Cranbourne or to the Warragul vaccination center. You can follow us on Facebook for latest updates, news, and live Kirtan Divans. Any closing words from Jason or Sukanya? Sukanya, would you have any closing words? You will have to unmute yourself.
Okay, the only way to prevent the COVID infection is get the vaccine. That's all.
Thank you. Thank you, Jason.
Yeah, and again, I have to fully agree. Just one thing at the federal level too, the mark we're looking at is obviously between the 70 and 80% vaccination, and you heard me read the figures before, and we are concerned about mental health and well-being too. But well done tonight, and can I say, you people on here tonight, you are the biggest ambassadors to tell your friends and family and everything else like that. Okay, have a great night.
Thank you. Thank you, everyone. Thank you, Jason. Thank you, Dr. Sukanya. Thank you, all attendees. Shri Guru Nanak Darbar is also going to have a impact assessment study trying to see what is the impact of COVID on our communities, Indian communities. So we will be sending you more information around this. I would also like to thank all those people who could make it tonight for this wonderful evening. I think we had about 70 people who attended this session on our various platforms. I would also like to thank our team at Shri Guru Nanak Darbar, especially Avtar, Randeep, and Gavin for taking the charge of all the logistical online management issues, technical issues. And thanks a lot, for being here. Hope to be in touch with you for more of such community forums in future. Thank you. Good night. Namaste. Sat Shri Akal.